Now the drugs used to treat blood disorders, and in that we have platelet inhibitors, then we have anticoagulants, thrombolytic agents, the drugs that are used to treat bleeding disorders, the treatment of anemia and sickle cell anemia. We see what are the platelet inhibitors. In the platelet inhibitors we have aspirin, and then clopidogrel, and then prasugrel, aspirin, clopidogrel, prasugrel. Then we have abciximab, cilostazol, and then we have dipyridamole, and then aptifibetide, and then ticlopidine, and tirofiban. So important to understand is that first of all these are the important drugs: aspirin, clopidogrel, and prasugrel. Then abciximab, cilostazol, and dipyridamole. Abciximab, cilostazol, dipyridamole. Then aptifibetide, and ticlopidine, and tirofiban. So these are the platelet inhibitors. Then comes the anticoagulants. In the anticoagulants we have the most important one is the heparin, and then related to heparin are enoxaparin, dalteparin, and tenzaparin. Heparin, enoxaparin, dalteparin, and tenzaparin. And then we have warfarin. And then we have ergatroban, and dabigatran. Ergatroban and dabigatran. Then we have fondaparinux, and lapirodin. So important one is here you have to remember heparin, and then enoxaparin, then dalteparin, and then tenzaparin. And then ergatroban and dabigatran, and then fondaparinux, and lapirodin. And then we have warfarin. These were the anticoagulants. Then comes the thrombolytic agents, and there are 4 thrombolytic agents that are very easy to remember: alteplase and retiplase. Then we have streptokinase and urokinase. And then for the bleeding disorders we use aminocaproic acid, aprotinin, protamine sulfate. This is the most important drug, protamine sulfate, vitamin K1, which is also called phytonadione, and tranexamic acid. Then for the anemia we use cyanocobalamin, which is vitamin B12, erythropoietin, folic acid, and iron. For the sickle cell anemia we use hydroxyurea, or pentoxyphylline. So these were the drugs that are used to treat blood disorders. See that the difficult one in this class is just the one that is anticoagulants, but we have to remember that heparin and the related heparins like enoxaparin, dalteparin, and tenzaparin. And then we have ergatroban and dabigatran, and then fondaparinux, and then lapirodin, and warfarin. And these we have to remember, like we have cilostazol, and we have dipyridamole, and abciximab, and then aspirin, clopidogrel, and prasugrel, ticlopidine, and tirofiban. Thank you.